Welcome to the Health Collective, your trusted source for all things health and wellness. We're here to bring you reliable, easy to understand, and actionable health information. Our mission? To empower you with the knowledge you need to take control of your health. In today's episode, we're tackling a topic that touches us all: skin disorders. From the common and irritating to the rare and severe, we'll discuss 10 skin disorders and provide guidance on how to treat them. Today we'll delve into 10 common skin disorders that you might be experiencing and how to treat them. First on our list is a common skin condition that affects many: acne. Acne is usually caused by an overproduction of oil, blocked hair follicles, inflammation, and bacteria. It's not just a teenage issue, adults can experience it as well. Acne often makes its unwelcome appearance on the face, but it can also show up on your neck, chest, back, and shoulders. Signs to look out for include whiteheads, blackheads, and pimples. But acne can also present as larger, more painful lumps beneath the surface of the skin. These are known as cystic lesions. Effective treatments for acne vary. Over-the-counter options often include products containing benzoyl peroxide or salicylic acid. For more severe cases, a dermatologist may prescribe retinoids or antibiotics. There's also the option of light therapy or chemical peels. It's important to remember that everyone's skin is unique. What clears up acne for one person may not work for another. Remember, everyone's skin is different, and what works for one person may not work for another. Next up, we have eczema, a skin condition that causes inflammation and itchiness. Eczema, also known as atopic dermatitis, is a chronic skin disorder often associated with a genetic variation that affects the skin's ability to provide this protective barrier. Common signs to look out for include dry, sensitive skin, intense itching, and a red, inflamed skin rash. The affected areas may also have rough, leathery, or scaly patches, and in some cases there might be oozing or crusting. Eczema can appear anywhere on the body, but it's most often found on the hands, feet, ankles, wrists, neck, upper chest, eyelids, and in skin creases. Treatment for eczema varies based on the severity of the condition. It often includes over-the-counter creams and ointments containing hydrocortisone. Others might require stronger prescription medications, light therapy, or even immunosuppressants. Remember, it's crucial to consult with a healthcare professional for an accurate diagnosis. Eczema can be a long-term condition, but with the right treatment, its symptoms can be managed. Another common skin disorder is psoriasis, characterized by red, itchy, and scaly patches. This chronic disease results from an overactive immune system that speeds up the skin cell's life cycle, causing them to build up rapidly on the skin's surface. The extra skin cells form scales and red patches that are sometimes painful. Psoriasis is not contagious, but it does tend to run in families. Symptoms vary greatly from person to person, but can include rashes or patches of red, inflamed skin, often covered with loose, silver-colored scales. These patches can become itchy or sore and may crack and bleed. Treatment for psoriasis aims to remove scales and stop skin cells from growing so quickly. Topical ointments, light therapy, and medication can help manage symptoms. Severe cases may require oral or injected medications. Lifestyle changes, like maintaining a healthy weight and quitting smoking, can also make a significant difference. Psoriasis can be a challenging condition to live with, but with the right treatment, you can manage its symptoms effectively. Rosacea is another skin condition that causes redness and visible blood vessels in your face. Often mistaken for acne or an allergic reaction, rosacea is actually a chronic disorder primarily affecting the convexities of the face. While the exact cause of rosacea remains unknown, it's believed that a combination of hereditary and environmental factors can trigger its onset. Some common signs include flushing, persistent redness, bumps and pimples, and visible blood vessels. Now, if you think you might be dealing with rosacea, don't fret. There are several treatments available, ranging from topical creams and oral medications to laser therapy. However, each person is unique, so it's always best to consult with a healthcare professional to determine the most effective treatment plan for you. Additionally, lifestyle changes such as avoiding triggers like spicy foods, alcohol, and extreme temperatures can also help manage the symptoms. Remember, rosacea is a chronic skin condition, but with the right treatment and lifestyle changes, you can control its symptoms. Hives are a skin reaction that causes itchy welts, which can range in size. They appear suddenly and can pop up anywhere on the body. Picture your skin turning blotchy with raised, red, and incredibly itchy patches. That's what hives look like. They're often triggered by an allergic reaction to foods or medication, but the exact cause can be hard to pinpoint. Now let's delve into identifying them. They appear as red bumps or plaques, often surrounded by a red halo. They can be as tiny as a pencil tip or as large as a dinner plate. They're infamous for their itchiness, but they can also burn or sting. When it comes to treatment, antihistamines are your best friends. They relieve itching and reduce swelling. Cool compresses can also offer some relief, but remember, hives are usually harmless, but if they persist for more than a few days, seek medical attention. Melanoma is the most dangerous type of skin cancer. It originates in the pigment-producing melanocytes in the skin. Unprotected exposure to the sun's harmful ultraviolet rays or the use of tanning beds can increase your risk of developing melanoma. Now let's talk about the signs. Melanoma usually appears as a new, unusual growth or a change in an existing mole. The ABCDE rule can help you identify some of the common features of melanoma: asymmetry, border irregularity, color that is not uniform, diameter greater than the size of a pencil eraser, and evolving size, shape, or color. When it comes to treatment, it can vary depending on the stage of the cancer. Early-stage melanomas can often be removed through surgery, while advanced cases might require a combination of therapies including chemotherapy, radiation therapy, and targeted therapy. Remember, regular skin checks are crucial for early detection and treatment of melanoma. Warts are skin growths caused by a virus on the surface of your skin. They're typically small, rough, and hard bumps that are often likened to the texture of a cauliflower or a solid blister. Warts can appear anywhere on the body, but are most common on hands and feet. The culprit behind these unsightly growths is the human papillomavirus, or HPV. This virus invades the skin through small cuts or abrasions, causing rapid growth of cells on the outer layer of the skin, thus forming warts. Now let's talk treatments. Over-the-counter remedies often include salicylic acid, which helps peel off the infected skin. Cryotherapy, a process where warts are frozen off, is another common treatment. But remember, these are just the beginning of your options. While warts are not dangerous, they can be bothersome. Consult a doctor if they don't clear up with over-the-counter treatments. Cold sores are small, painful, fluid-filled blisters that usually form near the mouth or on other areas of the face. Unlike a common pimple or a bug bite, a cold sore is typically the result of the herpes simplex virus. Now, before you panic, remember that this virus is incredibly common and is often contracted during childhood. You might notice a tingling sensation or redness before a cold sore actually appears. Once it does, it goes through several stages: the blister stage, the weeping stage, and finally, the crusting stage. Each stage comes with its own discomfort, but fortunately, there are treatments available. Topical creams or ointments can help to soothe the affected area and speed up the healing process. Antiviral medications can also be prescribed by a healthcare professional if outbreaks are frequent or severe. Cold sores can be painful and embarrassing, but with the right treatment, you can manage their symptoms effectively. Last on our list is impetigo, a common and highly contagious skin infection that mainly affects infants and children. This skin disorder is typically caused by two types of bacteria: Staphylococcus aureus and Streptococcus pyogenes. Impetigo usually appears as red sores on the face, particularly around a child's nose and mouth. These sores quickly rupture, ooze for a few days, and then form a yellowish-brown crust. It might sound a bit unpleasant, but it's important to know the signs. If you suspect impetigo, it's crucial to seek medical help promptly as it spreads rapidly. The good news is that impetigo is easily treatable. Doctors commonly prescribe antibiotic ointments or creams, and in severe cases, oral antibiotics. While waiting for a doctor's appointment, keep the infected area clean and avoid scratching. Cover it with gauze and tape or a loose plastic bandage. Remember, early detection and treatment can stop impetigo in its tracks. Impetigo can be uncomfortable and itchy, but with proper treatment, it usually clears up without leaving any scars. We've covered a lot today, and we hope you now have a better understanding of these common skin disorders. From acne to impetigo, we've discussed symptoms, causes, and potential treatments. Remember, it's essential to consult a healthcare professional for any skin concerns. They can provide accurate diagnoses and treatment plans tailored to your specific needs. If you enjoyed this video and found it helpful, please subscribe to the Health Collective for more health and wellness content. Stay healthy, everyone.